Hello, my name's Corey. I'm Arian. Wash my hands because I don't want to spread germs. How are you doing today, ma'am?
I'm doing good.
And what would you like me to call you?
Kara.
Nice to meet you. We're going to be doing a head-to-toe assessment today. It's going to take approximately about 20 minutes. Okay. Do you know who you are? No crazy question.
Yes.
What's your name?
Kara McMahon.
Good. What's today's date?
The 14th of July, 2016.
What day of the week?
Thursday.
Who's the president?
Obama.
Correct. Do you know where you're at right now?
Yes, Rising.
What is this place?
Your house.
Okay, correct. So her level of consciousness is ANO times 4. GCS, I can kind of tell, is 15. She has spontaneous eye movement. She's able to answer all questions appropriately, so her verbal response is adequate. And her motor responses are normal as well. So it's GCS 15, alert and oriented times 4. This time I'm going to go and just kind of inspect head to toe your skin. I'm looking for any lesions, nodules, any birthmarks, any redness, anything abnormal. So I'm just kind of briefly look. I'm not going to ask her to uncover or anything like that, so I'm just going to kind of look. Just inspect. I notice some freckles here. She got freckles on her arms as well. Look like she maybe got a little cut on her left arm, or excuse me, right arm. She got a tattoo to her left foot. I would inspect the rest of her body as well, her abdomen, back. I would inspect it for any lesions, nodules, anything abnormal, any redness, bumps, bruises, lacerations, anything just abnormal out of the normal assessment findings. Also, I'm going to kind of feel you here. So temp is warm. She is dry. So we didn't see any tenderness, no lumps, no bruises or anything. We made note of what we found. This time we'll kind of inspect your nails. Oops. You go and just kind of, there you go. So they are concave. No clubbing noted. They are about 180 degrees. They are trimmed, see-through, translucent. I'm going to check your cap refill here. So capillary refill is less than 3 seconds. So we've done inspected the skin and nails. We're going to go ahead and start moving from the head to toe assessment. So right now I'm just going to kind of assess your head, looking at it. It is normal cephalic. Her eyes are upper third, nose is midline, mouth is lower third. I don't see any lesions or anything like that. It's normal color. No redness, anything noted. Going to assess your scalp here. Just looking for any parasites, any scrapes, bruises. Her hair is dry, not oily. Color is reddish brown. I don't see any parasites, no lice or anything like that. So hair is healthy, scalp's healthy. This time I'm going to start assessing your face. Okay. So at this time it is, like I said, uniform with no lesions. Don't see anything. Okay. Facial features are symmetrical. At this time I'm going to start assessing your eyes. Like I said, it is the upper third part. I'm just going to assess your pearl, or your pupils, I'm sorry, that we did earlier. Okay, so pupils are pearl with accommodation. Okay. We could go ahead and start assessing cranial nerves here if we wanted to. So the eyes, like I said, the square are white. I don't see any redness, no jaundice noted. Her pupils are normal. They're about 4 millimeters in diameter. They were pearl. She has hazel-colored irises. Her eyelashes are intact. They are normal. No drainage there or any eye secretions. No watering, no redness, no swelling. So her eyes are intact. I'm going to start assessing your nose. It is, like I said, midline. No deviation noted. I'm going to look up your nose, okay? Normal passageways. I don't see any extra snot. No swelling, no redness noted in there. Are you able to breathe normally? Good. Okay. I'm going to inspect your mouth. Okay, uvula is midline, no redness noted. Tonsils are intact. You actually got some, looks like some tonsil stones. I'll get those checked out, sis. She does have a couple cavities. They are filled. Teeth look, besides that, healthy. The dorsal surface, her tongue is healthy, pink. The bottom surface, the visceral surface, or ventral surface, excuse me, is white, clear. Just have veins noted. Saliva is normal. Roof of her mouth, her palate is intact. No redness noted there as well. So I'm going to start assessing your ears. Any tenderness?
Mm-mm.
Any tenderness?
Mm-mm.
She's got normal recoil with elasticity. She does look like she has piercings. Is that correct, ma'am?
Yes, ma'am. Yes, sir.
So she didn't have any tenderness over the auricle tragus or the mastoid processes, which would be here. I'm going to start assessing your sinuses as well. I'm just asking you, does that hurt any? Okay. So sinuses are non-tender. So her ears are intact with normal elasticity. They are warm. I'm going to look in your ear, ma'am. Okay. And they're normal. No earwax really noted. She had very light serum. I think that's how you pronounce it. So they were normal. Or intact. No abnormalities noted. I know we're not supposed to use normal. So we've assessed that. We could use an ophthalmoscope to assess her eyes, looking for any redness or anything. I would also use the otoscope to look in her ears, looking for the tympanic membrane, see if there's any redness, swelling, any badness, redness noted, or heat. So we could kind of assess that with those two instruments. We've assessed the nose, mouth. So the lips are symmetrical. They are normal pink in color. They are dry. They're moist. So we've inspected the lips, mouth. Okay, I think we've done the face. Yes. So we're going to start with the neck. It is symmetrical. Runs in line with the head and chest. I don't see any. She's got some freckles on her neck, which is normal. So, like I said, I'll assess everything. Any tenderness, noted, ma'am? Okay, good.
No, sir.
So we're going to assess your carotid. Okay, so I'm going to kind of palpate your carotid pulse here. She's got a good carotid pulse on her left side. She's got a good carotid pulse on the right. So this time I'm going to auscultate. We're listening for bruits. Can you hold your breath for me? Okay, you can go and breathe. And hold it again. You can go ahead and breathe. I didn't hear any bruits. It's regular rhythm, pattern. So her carotid pulse was regular in rhythm with no bruits noted, and her neck is symmetrical. So at this time I'm going to start assessing the lymph nodes, the occipital, which is behind the ear. So I'm going to start assessing. Any tenderness?
Mm-mm.
Any tenderness?
No, sir.
Non-palpable. Okay. Now just kind of assess down. We can start assessing the posterior ocular. So on this side. Any tenderness while I'm pushing? Okay. No nodules or no lymph nodes noted, able palpable. So nothing is noted. I wasn't able to feel any of the lymph nodes. So we've done the occipital, posterior ocular, preocular, jugular diastric, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, and supraclavicle, which is above the clavicle. So I've assessed all this down here, the occipital, the posterior anterior, as well as the jugular. I'm not even going to try to pronounce that this time. My tongues are getting twisted and tied. It's kind of hard words to pronounce. So this time, I've assessed the lymph nodes. I didn't feel any swelling noted. So this time I'm going to start assessing the thorax and lungs. So I'm going to be looking at the chest, assessing to see if I see any pulsations or anything in that nature, any lesions, nodules, bruises, lacerations, anything there to the thorax or the lung area. Say it's normal. No abnormalities found. Did not note any lacerations or any tenderness. I'm going to kind of palpate, ma'am. I'm not going to get on your breast, don't worry, sis.
Okay.
Any tenderness or anything? Okay. So I've kind of palpated and assessed. This time I'm going to auscultate your lung sounds. Okay, I'm going to listen in 6 areas, front and back. Raise up your arm here. Another arm. I'm listening to your back here. Okay, so visceral lung sounds are present. No wheezing, stridor, rhonchi. Or no crackles were noted. I did assess in 6 different spots. You do from one side to the next to make sure that they are bilateral, equal, and clear. So you assess one part, let's say the left lung, go to the right and assess it. So we've auscultated that. So visceral sounds were present in the peripheral lung fields. Lung sounds clear to auscultation, like I stated, with no adventitious lung sounds. So I'm going to move on to the cardiovascular. Okay, so this time I'm going to kind of check your pulses. Okay, we're going to start from the radial is normal, the brachial. We've already assessed the carotid. Do the popliteal. And dorsalis pedis. And they're all normal. They're 2 plus normal bounding. And I didn't feel any irregularities or anything at that point. So this time I'm going to start assessing the heart sounds. Okay, so we're looking for, I could also look on the precordium area on the left side of the chest, mid-clavicle line, about where the apex of the heart. You're kind of looking for any pulsations or any abnormalities where you can see the heart actually beating through the chest wall. Younger or smaller frame people, sometimes you can see that. So sometimes it's a normal finding depending on the body size. So I don't see any pulsation at this time. So this time I'm going to start assessing the heart sounds. Okay, I'm going to listen to 5 different areas. We're going to do the aortic, which is the second intercostal space on the right sternal border. We're going to assess the tricuspid, the pulmonic, ABP, yes, pulmonic, which is the second intercostal, but it's onto the left sternal border. The Erb's point, which is the third intercostal space, the left sternal border. The tricuspid, which is the 5th intercostal space, yes, left sternal border. And the mitral, which is the 5th intercostal space, but it's the mid-clavicle line. So I'm going to start assessing you. Come in. So I would kind of feel here, looking for the intercostal space. So 2. So this time I'm assessing aortic. I'm on the right sternal border, 2nd intercostal space. S1, S2 noted. No S3 or 4 sounds noted. No murmurs, no tics. So this time I'm going to move over and assess the pulmonic, which is the 2nd intercostal space, or left sternal border. S1, S2 is noted. Now 3 or 4. And no murmur or tics noted. So I'm going to move down 1 intercostal space. I'm listening for the Erb's point. And it's at the third intercostal space, left sternum border. And I hear the S1, S2. No S3 or S4 noted. No murmurs, no tics. I'll move down to the fifth, left sternal border. Listening to the tricuspid. S1, S2 is noted. No S3 or 4. No murmurs or tics. And now we go to the, kind of raise it. Would you, sis, I don't want to, there you go. So, the fifth intercostal space, mid-clavicle line, I'm listening for the mitral. S1, S2 is noted. No S3, no S4, and no murmur or tic noted. So, no abnormalities heard during the cardiovascular assessment of the heart. So we assessed the aortic, pulmonic, herbs, the tricuspid, and the mitral valve. Okay, so at this point, I'm going to ask you to go ahead and lay back now. We're going to assess the abdomen, like we did in the other video. So, assessing abdomen here, kind of inspecting. I'm not going to raise up her shirt for modesty issues. So I'm inspecting, asked earlier in the other video if she had any tattoos, so no tattoos noted. Looking for any bruises, lacerations, nodules, anything swelling. Looking for pulsations for possible an aneurysm, abdominal aortic aneurysm or triple A. I don't see any pulsations. I don't see abnormalities. Her skin color is normal. You could assess the skin color, temp, condition here. So everything is, no abnormalities noted here. So normal skin color, Caucasian, white, no redness, no erythema, no warmth. And we could kind of touch when we do the palpation part of it. So nothing noted, normal, no tattoos or anything like we asked you, no stray or anything like that. So this time I'm going to go ahead and auscultate like we did earlier. Okay, so bowel sounds are present, they are active. They are within normal limits, 5 to 10 per about every 30 seconds to a minute. Like I said in my other video, we were taught to auscultate for at least 5 minutes in each quadrant to really get a full assessment of what the abdomen and abdominal sounds, bowel sounds are doing. So she's got normal peristalsis going. Didn't hear any hypoactivity or hyperactivity noted. So this time I'm going to palpate like we did earlier, ma'am. So I'm going to start and kind of feel the left side here, or excuse me, right side. So you can kind of assess any tenderness. You know? You kind of feel the liver here. I'm going to the left side, which covers the stomach, spleen, pancreas. You can kind of feel the stomach. Any tenderness noted. Okay. Moving down to the left lower quadrant. Feel low enough, you could feel an ovary. Any swelling, anything like that, you kind of know any tenderness. You go to the right side. Any tenderness. So you could kind of feel for the appendix. You would look for rebound tenderness in the right lower quadrant as well. Just really, especially depending on their signs and symptoms. So her abdomen was rounded concave. So we've done the abdomen assessment. So we've kind of went all through all the 4 quadrants. You could do percussion as well. As like I said, I'm kind of learning that. Kind of hard to do, but I am learning it. Got some really good doctors I work with teaching me that. So good assessment on your abdomen. So we're going to check your peripheral vascular. I did that earlier when I did the cardiovascular. Just kind of do it again. So I'm looking for any edema. Kind of inspect it. So she got a little abrasion there. So kind of look at her hands, her peripheral vascular areas. Okay. So no edema noted. No swelling. No edema noted, as like I stated. See your hands now. No edema noted. And you could go ahead and check the pulses again as well with the radial. Normal bounding, 2+, normal rhythm and rate. Brachial, 2+, regular rhythm and rate. Palpatale, normal, 2 plus, regular, rhythm and rate. Alice Pettis. And they were 2 plus, normal, regular, rhythm and rate. So we've done a head or toe assessment. We kind of missed out on things we did with the other video, so thank you again for assisting me.
You're welcome.
You have a good day, man. Everything is good? All right.